All right, the new year gives us all a bit of a fresh slate, wouldn't
Absolutely,
you say?
right?
Yeah.
Woo-hoo.
And to take advantage of it sometimes means you have to put yourself first.
Absolutely. We're going to be checking in with psychologist Dr. Laura Saunders to help us all feel a little bit better and more empowered in 2023. Good morning, Dr. Saunders. How are you? Happy 2023.
Yeah, Happy New Year.
Hello, friends. Happy New Year. I'm happy to be here.
You know, I was watching Shania Twain. She was on another network this morning, which I will not mention. But she's been through the ringer. She, you know, her documentary, and, you know, she had past abuse in her childhood, and she came out with her pink hair today, and she was like, I'm pink because I'm embracing myself, and I'm empowering myself, and I'm loving myself.
Body positivity.
Body positivity. You know, this is a step in the right direction, right?
Absolutely. So I want to talk about empowerment, and I actually want to talk about empowerment in these segments here in the month of January, because we all need to empower ourselves. We all need to be strong and confident and take some sense of agency and control over claiming one's rights and claiming your life and making good decisions. Instead of feeling like things are cascading over you and you have no control over your life, this sense of empowerment, like I have some control, I can make good decisions, I have an ability to have an effect on the outcomes in my life. Look, we don't have a lot of control, but we need to exert some control because, you know, we know that about 85% of the world's people are affected by low self-esteem. And that is really significantly linked to mental health as well as physical health problems.
And how does that self-esteem relate specifically to mental health? What are some of the downsides, Dr. Saunders?
So the more our sense of empowerment is low and our mental and physical health is on the decline, it affects our energy. It affects our sleep. It affects our, you know, we engage in more unhealthy habits. So the more we feel bad about ourselves, the more likely it is that our thoughts are going to be negative, and then we're going to engage in behaviors that do not help us feel better, right? I mean, really, it is that old adage, you know, when the oxygen drops down from the airplane, right, you got to put your mask on first before you put someone else's mask on.
So true. Self-care is so important.
It's so important. All right. So, you know, a lot of people say that their mental health has declined significantly since the pandemic. Have you seen that?
Yes, we have seen that. So I just think it really allowed people to understand that we really don't have any control, right? There's this whole global pandemic, and we had no ability to control anything. So I think that just cascaded into, you know, people wishing they had more respect for themselves, women not feeling as attractive, people feeling bad about their body image. So it really had a cascade of negative effects.
So the big million-dollar question, what can people do to help themselves and help themselves feel empowered as we start this new year?
So the two low-hanging fruit in empowerment is about changing mood and energy. And the two easiest ways to affect your mood and your energy are sleep and nutrition. Getting a little bit better sleep and a little, you know, I'm not talking about massive overhauls. I'm not talking about going to the gym 5 days a week. I'm not talking about any of those things. It's making slight changes in increasing the time you go to bed so you get more sleep, and just making some slight changes in your nutrition. It helps with mood and energy.
I'm in the middle of Dranuary, which is dry January. That's what I'm calling it.
Dranuary.
And what do you think about this movement? You know, I'm doing it, but I think, Doc, if I don't get to the end of this by completing it, that there's something wrong with me.
Right. So actually, what I've heard called is dry-ish January.
Okay.
Right.
Oh.
So that's a little bit more. I mean, yes, we want to look at our habits and look at which of our habits are helping us feel better or not helping us feel better. So to cut back, to be more mindful, to keep track. I mean, you know, one of the things they say about nutrition and good health is like keeping food diaries, doing things to be more mindful about what you're taking into your body. But I don't want it to be an all or nothing. Like once, you know, you've had a drink, bam, it's blown for the whole month, and now I'm just going to go back to old habits. So it's giving yourself permission. That's why it's called dry-ish, right? Okay, well, I might have had a drink yesterday, but you know what? I really want to just be more clean in my health for the rest of the week, and giving yourself permission then to move forward with that.
All right.
One more quick question, Doc. You know, Scott was talking about dry January, a big change that some people are making. And when we enter a new year, it's in our face that we have to change everything, right? And just being a consumer, it's just, you're really vulnerable, I would say. What kind of advice do you have for people going forward who maybe you don't necessarily have to change some things, but people feel the pressure like they do? And I'm sure that ties in with self-esteem.
Yeah, so, I mean, I do think the beauty of the new year is engaging in some self-reflection, right? What worked for me in 2022? What, you know, am I setting some goals for 2023? But let's be realistic, right? We're not making massive life overhauls. We're making one change or one or two changes, or, you know, working on improving a relationship or working on being more compassionate and less judgmental. So it's making smaller changes, not making massive changes, and really working on that self-talk, that negative self-talk that many of us engage in. Really trying to turn that around, because that really disempowers us.
All right. Well, I love your cowl neck, and we appreciate your time.
Happy to be here. Have a great day.
Thank you. And next week, we're going to talk with you about how to boost your self-worth.
Yeah, that's good, too.
All right.
Yes.
All good stuff.
Thanks, Doc.
Thank you, Doctor.
Take care.